Hello everyone, welcome to NG's Corner for Nurses. Hope all of you are doing well. If the videos of this channel are useful for you, then please share these videos as much as you can so that it can reach to more people. Let's start today's topic, that is hand hygiene. In this video, we will cover the hand hygiene including its definition, purposes, movements, importance, types and steps. And also we will cover the glove pyramid. Let's see what is hand hygiene. Hand hygiene is a method of cleaning one's hands and significantly reduces potential pathogens, which are harmful microorganisms on the hands. Hand hygiene is considered to be a primary measure for reducing the risk of transmitting infections among healthcare workers and patients. Ignaz Semmelweis is the father of hand hygiene. Hand hygiene procedures include washing hands with soap and water or alcohol-based hand rubs, which should be 60% to 95% of alcohol. Why we will perform hand hygiene? Because thousands of people die every day around the world from infections acquired while receiving healthcare. And hands are the main pathways of germ transmission during healthcare. Hand hygiene is therefore the most important measure to avoid the transmission of harmful germs and prevent healthcare associated infections. There are many evidences that hand hygiene can reduce the burden of healthcare associated infections, decreases the rate of incidence of urinary tract infection, surgical site infection, ventilator associated pneumonia, central line associated bloodstream infections, reduce the duration of patient stay in hospitals and associated costs, reduce the burden of multi-drug resistant organisms, reduce the development of severe complications, and improve patient outcome in critical care. When we will do hand washing? Prior to performing surgical procedures or assisting in one, a surgical hand scrub is to be performed before putting on sterile gloves. For non-surgical procedures and for patient examinations, an alcohol-based hand rub or hand wash with water and antimicrobial soap can be used. Next, there is 5 moments of hand hygiene according to World Health Organization. Note that hand hygiene must be performed in all indications described regardless of whether gloves are used or not. First is before touching a patient. Clean your hands before touching a patient when approaching to him or her to protect the patient against harmful germs carried on your hands. Second one is before clean or aseptic procedure. Clean your hands immediately before performing a clean or aseptic procedure to protect the patient against harmful germs, including the patient's own, from entering his or her body. Third one is after body fluid exposure risk. Clean your hands immediately after an exposure risk to body fluids and after the glove removal to protect yourself and the healthcare environment from harmful patient germs. Fourth one is after touching a patient. Clean your hands after touching a patient and her or his immediate surroundings when leaving the patient's side to protect yourself and the healthcare environment from harmful patient germs. And fifth one is after touching patient's surroundings. Clean your hands after touching any object or furniture in the patient's immediate surroundings when leaving, even if the patient has not been touched, to protect yourself and the healthcare environment from harmful patient germs. Apart from the 5 moments, there are some additional opportunities to perform hand washing. before entering the facility or ward, before attending to a patient, before putting gloves, after removing gloves, before and after performing procedures, before attending another patient, before and after touching equipments, before and after touching your face, mouth, eyes or nose, when hands are visibly soiled, before and after handling food, eating or feeding patients, after visiting toilet and after leaving the facility or ward. Next is importance of hand hygiene. Maintenance of proper hand hygiene helps to reduce the risk of transmission of germs causing infection and helps to prevent the development of healthcare associated infections. There are three types of hand hygiene: social or routine hand hygiene, antiseptic hand hygiene, and surgical hand hygiene. Social or routine hand hygiene is washing hands with soap and water to remove dirt and organic material, dead skin, and most resistant microorganisms. Antiseptic hand hygiene is washing hands with soap and water or with other detergents containing an antiseptic agents. Next is surgical hand hygiene. As the name suggests, this is a cleaning procedure that is used prior to sterile operations, including surgical procedures. It includes both hand rubbing and hand washing. Hand rub reduces the transient flora without necessarily affecting the resident skin flora. And hand washing requires moving or killing off transient microorganisms from the nails, hands, forearms to reduce the resident microbial count to a minimum and to inhibit the rapid rebound growth of microorganisms. During surgical hand washing, hands and forearms are scrubbed up to the elbow. Only the sterile towels are used to clean the skin, and this procedure ensures to stay off any cross contamination or cross infection. As per WHO guidelines, typically it takes 3 to 5 minutes. As per WHO, the 0 to 11 steps of hand washing. The duration of this entire hand washing procedure is generally 40 to 60 seconds normally. 0 step is wet hands with water. First, apply enough soap to cover all hand surfaces. Step 2, rub hands palm to palm. Next, right palm over left dorsum with interlaced fingers and vice versa. Next, palm to palm with finger interlaced. Next, back of finger to opposing palms with fingers interlocked. Next, rotational rubbing of left thumb clasped in right palm and vice versa. Next, rotational rubbing backwards and forwards with clasped fingers of right hand in left palm and vice versa. Next, rinse hands with water. Dry thoroughly with a single use towel or a paper towel. Use towel to turn off the faucet or use your elbow to turn off the faucet. And your hands are safe. This is the 11th step. So this total step is 0 to 11 steps of hand washing. Next, as per WHO, steps of hand hygiene using alcohol-based formulation. The total duration should be 20 to 30 seconds. There are 8 steps. First is apply a palm full of the product in a cupped hand covering the all surfaces. Then rub hands palm to palm. Then right palm over left dorsum with interlaced fingers and vice versa. Then palm to palm with fingers interlaced. Next, back of finger to opposing palms with finger interlocked. Next, Rotational rubbing of the left thumb clasped in right palm and vice versa. Next, rotational rubbing backwards and towards with clasped fingers of right hand in left palm and vice versa. And the eighth step is, once dry, your hands are safe. Dry it in a air. Next, coming to the surgical hand rubbing technique. Hand wash with soap and water on arrival to or after having donned theatre clothing. Use an alcohol-based hand rub product for surgical hand preparation by carefully following the technique illustrated in images 1 to 17 before every surgical procedures. And when gloves are removed following the operation, hand wash with soap and water. Repeat this sequence average 60 seconds, the number of times that adds up to the total duration recommended by the alcohol-based hand rub manufacturer's instruction. This could be 2 or even 3 times. There are some attributes of an alcohol-based hand rub are as follows. More effective at killing germs, less time consuming, more accessible and known to produce less bacterial counts on hands. Next, coming to the glove pyramid. As per WHO, it is a decision-making tool when to wear gloves and when not to wear gloves. Gloves must be worn according to standard and contact precautions. The pyramid details some clinical examples in which gloves are not indicated and others in which clean or sterile gloves are indicated. Let's see the pyramid. The use of gloves does not replace the need for cleaning your hands. Hand hygiene must be performed when appropriate regardless of the indication for glove use. Remove gloves to perform hand hygiene when an indication occurs while wearing gloves. Discard gloves after each task and clean your hands. Gloves may carry germs. Wear gloves only when indicated according to standard and contact precautions. See the examples in the pyramid below, and otherwise they become a major risk for germ transmission. Each year, 5th May celebrated as World Hand Hygiene Day. Save lives and clean your hands campaign aims to progress the goal of maintaining a global profile on the importance of hand hygiene in healthcare and to bring people together in support of hand hygiene improvement globally. These are the references. If this video is useful for you, then it is requested to put a like. And for getting more videos like this, you can subscribe my YouTube channel or follow my Facebook page NG's Corner for Nurses. And for any queries or suggestions, you are most welcome to comment. Thank you for listening.